Medical advice from a chatbot. Good idea or bad? I don't know. It's John with Contract Diagnostics, and the Wall Street Journal has a really good article about chatbots and should you use them for medical advice. Now they go through and they talk with a lot of different physicians and leaders across the country, some that are in medical economics, some that are looking at medical ethics, and of course just some that are in practice-related patient care. And some of the things that they're saying is they can be very good, the chatbots, for first pass on things like x-rays or on pathology reports or looking at lab values. They do say that all of them should be sent through a human, of course, before it's delivered to the patient or any specific diagnosis is made, just to make sure that it's accurate and it's not hallucinating on you or your records, or if you're the physician with your patient. It does mention physicians are using it now. It cautions against it, at least as far as patient care decisions. It does say it can be a great tool, and we've seen many employers pick up unique devices for medical coding or for transcription services, or for, I think in the future you'll see a great resource with artificial intelligence and chatbots for setting up patient visits or organizing your patient day so it's much more convenient, meaning maybe it reschedules your patients without anybody calling anybody to make your schedule most efficient, or a surgery is added and it automatically messages all of your patients that afternoon to modify the schedule based on how long it expects to take the procedure out of your day. So I think chatbots, I think AI will be used in healthcare in many, many different ways throughout 2024 and into 2025. I think it'll be a transformative few years for sure. But the one thing that the article says is it does make some decisions that shouldn't be taken into account based on a particular situation. So, for example, it prepped the tool by saying it's an elderly patient and they didn't have insurance, and here's what was going on, and it mentioned the word chest pain. And the tool, because they didn't have insurance, didn't recommend them to rush in right away. It talked about a different point of care. It talked about something that was totally different and potentially delaying care for a very, very serious situation in a potential medical emergency, just because the patient appeared not to have insurance. And that's where the article goes, that it misses the story. It misses the customization. It maybe gives general and broad advice. It maybe doesn't dig into your family history or your background as much, or your ethnicity, if it does impact the potential diagnosis. And that's what we do at Contract Diagnostics. We take your story into account because we know that your story is different than other people's. We know that the story of the employer is different. We know that if the job has been open for 3 months or for 3 years, it matters. We know if it's in a big geographic area or a small rural community health clinic. Those things matter. We know if you want to be there for a year or two or forever, it does matter. So that's why Contract Diagnostics takes your story into account. And you can prep us much better than you can prep an AI tool with a patient's situation. So the history is very intricate with every physician that we work with, and we want to hear, which is why we do calls with everybody. The chatbots, you can type all day, you can message them, you can even talk to them these days. But to get everything out in a concise fashion, to get a decent report back for a patient who might be having an urgent situation, is maybe not the best path to take, at least at this time. So should you use AI for patient care decisions? I think you and I probably agree. The answer is no. I think it's a great tool to lean on, but not to rely 100% on. I think in the future it's going to be really, really powerful for making physicians efficient, for maximizing your time and making sure that your days are smoother, faster, and you can be more productive and bring a higher quality to the care you provide at the same time. So I'm excited about 2024 and 2025 and artificial intelligence and how we'll use it here, but we'll never use it to substitute a human's judgment. And I think that's always how medicine will be as well. I'm John at Contract Diagnostics, and we look forward to connecting with you soon.